In this video, I'm going to talk through how to write your quantitative discussion section for a literature review done systematically. Let's just have a quick overview of where you have come from already, because well done, you are now on step 8. So we're talking about presenting the findings, specifically presenting your discussion section. I'm going to assume that you've already done your introductory paragraph, and if you're not sure how to do that, go back and check out the general discussion video. But now we're actually talking about writing that main bulk of the discussion. And I want to say a really big thank you to Associate Professor John Williams for his help with constructing these slides and how to present this in the best possible way. So when you're doing your quantitative discussion, you're really wanting to be explaining the differences in the results. So you're going to pick 3 key aspects or themes that are important and explaining those differences. And I've said 3 because that's really the sweet spot in terms of the amount of words you'll have and the depth you need to go to. You can do that relatively well with 3 points. If you start doing 4 or 5 points, you can do that, but you may well run out of words, and so you're not going to get the same depth. And you do need a level of depth to demonstrate your learning from these sections. So that's why I say 3 really as the sweet spot. You could be in a situation where 2 studies found a difference and 4 studies found no difference. So why might that be? Or it could be all studies found a difference, but some differences were greater than others. Again, why is that? So why did some studies with similar methodologies and interventions have different results? That really is the essence of this discussion section. So even if all of the studies had the same overall outcome, why was the size of the difference bigger for some rather than others? So this is the how-to guide really on how to do this. Step 1, you are going to identify the differences in the outcomes and findings. So it could be study X and Y found a significant difference, study Z, A and B did not. Step 2, you're going to look at your data extraction table, also called your study characteristics table, and you're going to drill into that to try and see what were the differences between the methods in the group that found a difference, X and Y, and the group that didn't find a difference, study Z, A and B. And the hint with this, it will usually lie in the population, the intervention, or the outcome. Step 3, you're going to select your reason and you're going to discuss with absolute blinkers on. You are going all in for why that's the possible reason that explains that difference. Now, of course, you don't really know why those differences are there. And so if you don't know, you have to write your language quite speculatively because you're making suggestions as to why they may or may not be different based on your understanding of the literature and your clinical background. Step 4, you're then going to select another reason as to why that possible difference may be there. And you're going to go all in and discuss that. And then you're going to repeat again. So that's a general overview of the how-to guide. Now let's have a look at some examples. So let's take population as an example. So studies X and Y found an effect on balance. Studies Z, A and B did not. You'll write something like, this discrepancy in findings may be explained by difference in the sample used. Z and Y had a relatively young sample age, mean of 25 years, and Z, A and B had an older sample age, mean of 50 years. And so then tell us why you came up with age as a factor, like what logically makes sense about age in relation to balance. Something like, age has been shown to influence both balance and response to exercise. You're going to want to provide references there, and these references are outside of the article that you used in your review. That is how you get the wider literature into your quantitative discussion. You have to think critically about why that may be a factor. For example, something like, this suggests that age may be a mediator of the effect on, and then whatever it is that you're going to be looking at there. So that's an example on population. Next, an example on intervention. Studies X and Y found an effect on balance. Studies Z, A and B did not. This discrepancy in findings may be explained by the differences in the intervention used. And again, you can paraphrase that sentence so you're not saying the same thing every single time. It could be that X and Y had progression built into the balance program, but Z, A and B use the same exercise throughout. And this is all coming from your data extraction or your study characteristics table, whatever you want to call it. You could say something like, progressive challenge challenge is important because blah, 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 blah. Add your references. This suggests that in order for interventions to be effective, progression should be included, and then you could have a summary statement at the end of that paragraph. So that's an example on intervention. Now let's have a look at an example for outcome. Again, X and Y found an effect on balance, Z, A, and B did not. This discrepancy in findings may be explained by the difference in the outcome measures used. X and Y examined static balance, postural sway. Z, A, and B measured timed up and go. Dynamic balance and static may be similar, but have distinct physiological constructs. Again, references there. This suggests that the findings are not universal across all constructs of balance. So that's an example for outcome. So the formula, just a reminder, you are going to state the difference in findings. You're going to speculate why this might be. This is your key discussion point 1. You're going to provide evidence from your included studies for this phenomenon. You're going to talk about why this thing, whatever it is, may be important and how could it explain the differences, pulling in the wider literature there. Then you're going to have a summary statement, recommendation to practice, and future research. You're welcome to integrate your recommendations for practice and future research into the main discussion, or you can have it as a separate section. I don't really mind. I think it's just the important thing is as long as it's in there somewhere. But what if you might be in a situation where all studies showed a significant difference, but the magnitude of that difference will be different? And so these differences would then form the basis of this discussion. So X and Y had a small but significant. Z, A, and B had a large change. So why might that be? And then this follows the same formula as before. So despite all studies showing a significant difference, the magnitude of that difference was not the same across all studies. This could be explained by same formula, population intervention outcome, whatever it is you think is important to be talking about. Or all studies actually showed no significant difference. So this is a slightly more tricky scenario as you can't talk about the magnitude of the differences. So we need to write it a little bit more cleverly. So what you can do is you just need to reframe it a little bit. So step 1, you would declare the expected difference with support from the literature. So what were you expecting the findings to be showing? So, for example, we would expect to see a difference in physiological response based on the age of participants, references there. However, we did not find that. Step 2, discuss why you think the findings were different let me start again, sorry. Step 2, discuss why you think the findings were different from what was expected. Step 3, summary statement, recommendations for practice. So that's an example of how you could handle that one. So overall, your quantitative discussion structure, you're going to have your introduction paragraph, and then you're going to have findings related to your population, your intervention, and your outcome. So actually, you could use population, intervention, outcome as subheadings. I think that's completely fine because it just gives more structure to your review discussion. This is my caveat here because this formula may not work exactly for your review, but is there anything that you can take from this video that you could be applying to the way that you actually write up your review? It's really tricky for me to give a formula that will work for all of you. You'll all be looking at slightly different things, slightly different quantitative approaches. So probably one of my other top tips in closing here, actually, before you start writing your discussion, go and have a read of a couple of quantitative discussion sections to give you a little bit of a feel for what you'd be expected to be including. And so I've included some links to 2 quantitative examples in the description. So have a look at those before you jump into writing it. But generally, that's how you would go about writing a quantitative discussion. So as always, I'm probably going to close with this, don't overthink, get that first draft down because then you can edit it. So just go for it. Just really have a go. Please, if you're getting value from these videos, can you give it a thumbs up? subscribe, and then share these with anyone else who you think may benefit from the content. Maybe you've got friends at other universities who are studying physio and are also having to do a review. So please flick this link to them, and then they can have a look, and hopefully that will help them, and we can support lots more of you doing high quality reviews and hopefully getting a little bit more enthusiastic about research so that we can keep adding to our research profession. So thank you for watching.